All right, Jessica, thanks so much for being on the Friends with Wills podcast. I appreciate it. First off, if you could tell the audience a little bit about you and how you started, that'd be great, and we can go from there.
Sounds good. Okay, first, thank you so much for inviting me to be on your podcast. My name is Jessica Keltner, and I am a physical therapist and have been for close to 25 years. And the way I started in that is I actually grew up in a small rural community in Missouri, in a little small town. And I knew that I really enjoyed math and science, and that I'm very much an extrovert and a people person. And so I was drawn to the medical field, but in a small town, I didn't have any idea what my options were. And so I took an interest survey when I was a junior in high school that kind of showed me different career paths that might suit me, and physical therapy came up. And honestly, at that age, I had no idea what that was because I had not received physical therapy myself. And so I went and I shadowed a little outpatient physical therapy clinic in my little small hometown in Missouri, and I fell in love with it. And some of the things that set it apart for me were that it was in the medical community, but unlike being a physician or something of that nature where you might see someone once a year, once every 6 months or so, I got to invest and be a part of someone's weekly journey toward better health and see them often. And you just develop a closer relationship a lot of times with your patients, your clients. And so that was what drew me to that career path. So, and I love it. Love serving my patients and my clients very much.
hmm And what was it like going through PT school and all that?
Ooh, that's a good question. So it's certainly changed a little bit because that was again 25 years ago. At the time I applied, you did not have to have an undergrad degree, but you had to have a lot of math and science coursework for your prerequisites to get accepted. And it was pretty competitive. So you had to have decent grades and be good in the math and science world. But then you also had to do a lot of shadowing and observation to make sure that was a good fit for you, and through quite a bit of interview process. And then the actual PT school program at the time was still 3 years, much like it is today. And it was a master's program back then. And it was intense. It was intense. It was an intense 3 years with a lot of in classroom coursework, but then also a lot of clinical rotations kind of programmed throughout. And so you would do maybe a 6 week rotation or an 8 week rotation, actually in the trenches, if you will, treating patients and getting a real taste of what that would look like every day. But it was great. I really loved it and keep in touch with many of my classmates even 25 years later.
hmm That's great. So what do you
Mhm.
do now as a physical therapist? What sorts of populations do you work with?
Sure, that's a great question. So, for at least for the last 10 years, up until about 6 months ago, I worked in a rural town, still in Missouri, a smaller community, in an outpatient physical therapy clinic. So, not attached to a hospital, but a place where people will come to see me. And being in a small community, the beauty of that is I would see a little bit of everything. And so I had anywhere from toddlers on occasion with different disabilities and or injuries of some sort, all the way up to people in senior citizens in their 90s with fall risks. And then I would see athletes and um, anything and everywhere in between. But um, what I did about 6 months ago, mostly because of just changes with insurance coverage and whatnot, and the changing landscape with that, is I decided to open my own business, still in rural Missouri, but I added a functional wellness piece to my practice. And so, in addition to still doing physical therapy with all different clientele in an outpatient setting, I also do a little functional wellness piece. So, if people are looking to take a next step after they finish physical therapy and have bigger goals that maybe their insurance won't cover, or are maybe needing a little help knowing how nutrition plays a part in fueling their recovery to better health, I can help work on those things with them that maybe insurance wouldn't cover with standard physical therapy. So it's kind of given me an opportunity to marry what I was already doing to something that I'm passionate about, which is helping people elevate their overall health and get back to their highest functioning self, if you will.
hmm And so, like,
Mhm.
how do you do that? Like, do you focus on like you could do leg strengthening, or do you work with patients on strengthening parts of the body? Because again, you work with like younger toddlers to like athletes and like older
Mhm.
adults. So, like, what do you sort of focus on with those populations, I guess?
Ooh, that's a good question because it I will say it varies very significantly depending on the patient. So when someone will first come to me, for example, I will take quite a bit of time doing a pretty thorough interview about what they've been through, and what their goals are, and kind of what treatment they've had up to that point. And so it really depends very much on the patient. So I'll give you a patient scenario, for example. I have a client that I'm seeing right now who's actually in his 70s, and he originally had an injury to his lower leg, where had a fracture in his lower leg. And through his physician, he was given a boot to wear, and then he was given a few exercises. But when he was finished, he was still having pain and was still very, very limited, in his ability to walk and do different things around his house. And so he was also a fall risk. And so when I did his interview, we also found out that he suffers with diabetes. And so we needed to address that piece because that interferes with healing, and recovery. And so I got to take him and help do, a thorough assessment of his entire body, top to bottom, and that included his posture, some things that were going on with his lower back, his hip strength, his lower leg strength. But then also we talked a lot about what he was eating, to make sure that he was feeling his body properly to help him recover. And so in that case, we did a lot of exercises specifically geared toward his deficits. So including his balance, his hip strength, his back strength, his posture. But then we also talked about different ways that we could adjust his nutrition to make sure we were meeting his goals and giving him what he needed to recover. Does that make
Hmm.
sense?
Yeah,
Yeah.
yeah, that makes
Mhm.
sense. But what have you worked with other populations, like someone with
Sure.
with a spinal cord injury, or someone, who with like cerebral palsy, stuff like that?
Yeah.
Because I'm sure there's
Yeah.
a lot of clients out there.
Absolutely. Absolutely. So I've had different clients anywhere from, maybe after a stroke or a head injury of some sort. I've had, clients with cerebral palsy for sure. And then I've had a couple clients. I had one with a very severe, um, congenital brain deformity called, Sturge-Weber syndrome, which comes with a lot of pretty profound disabilities. And so in that case, while my end goal, the end goals are still the same to help them to be as independent and functioning at their higher level as possible. We'll just maybe take a different pathway to get there. And so, in the case of some of the children, if they need a caregiver, for example, a lot of it involves assessing the patient really thoroughly to figure out what they need, but then also really heavily educating the caregiver to help them in such a way that boosts their independence. Because a lot of times, caregivers sometimes even give too much help, which kind of impedes the independence of the patient, if that makes sense. And so
Yeah.
helping them understand that it is good to help them, but sometimes you can help too much, and kind of help them find that balance. So that's a definite different way to approach caring for that, group of clientele, if that makes sense.
Mm-hmm. And in that physical therapy headspace, how do you sort of adapt to different populations' needs? Because for one person with a spinal cord injury or cerebral palsy, it might be different from like what you said, the older adult,
Yeah.
with mobility issues that has diabetes. So how do you sort of um adapt to whatever needs they may have? Like in that headspace, what are you sort of thinking in that moment?
That's a good question. So, what I have found most valuable is that if I go into, my patient evaluation for somebody, my end goal is to make sure that I'm very sensitive and interview really well in such a way to make sure that they are meeting their goals. So, for example, someone who, might be coming in after a spinal cord injury, um, it will depend very much on whether their goal is to live alone versus whether they have someone, a spouse or a caregiver that will live with them, and then make sure that our goals will be to set realistic goals for them given their injury. And so trying to figure that out. But then I will say, as a physical therapist, once we do that interview, we may have a certain treatment plan, but we are continually making adjustments as the patient shows progress. So if they're, um, if they're, I'll have a good example. I had a patient who was 19 and she had a brain tumor. And as a result of her brain tumor and the removal of that tumor, she was left with some pretty significant disabilities. And so when she first came to me, she was, she was wheelchair bound and very dependent for all of her daily activities on her caregiver, which was her grandmother. But her goal as a 19-year-old was to eventually live on her own. And so the way we addressed that was we first worked on our goals to get her as independent as possible within the um, in her current situation with her caregiver. But that required a lot of education with her grandmother to not give her too much help. But then looking out into the community, what are trying to seek out what other services were available to her to help her become as independent as possible. So, trying to find her a very accessible apartment to live, helping her access ways that she could get, if she couldn't get to the grocery store on her own, how could she get groceries delivered? And just helping her find all the different resources available in her community to get her to that goal and make her as independent as possible. And then inside the clinic, similarly, we worked on as much trunk control, arm strength to help her power her wheelchair until she was able to move from the wheelchair into a walker, finding the most appropriate walker that would serve her best and give her the most independence. So in that case, it ended up being a walker that had a chair attached to it so she could sit when she needed to, and getting all the different adaptive equipment to make sure she could navigate in a community on her own.
Mm. That's cool.
Mhm.
So like how's she doing nowadays?
She's doing awesome. She is living on her own. I'm so excited to say that she's living on her own. And then one of the beautiful things is, and I'm going to struggle with the name of it, but there's a way that you can have a family member be reimbursed by your insurance to help you as a caregiver helper. And
Uh,
so, I mean, you may know,
yeah, I think it's called like an individual like an individual provider or something like that.
right?
I know an individual provider, I guess.
Yes, something like that, right?
Yeah.
And so she still lives on her own, but then her grandmother is reimbursed by her insurance to come in on occasion to help her with a few housekeeping duties, and occasionally if she needs help, putting groceries away or things like that. But now she's also able to. She's found an online job that she can do, so she's employed, and she's doing great. So it's been beautiful to see her go from a place of being fully dependent, full time on a caregiver, to now living on her own, and having some services come in, but able to live on her own and realize her dream of being more independent, which is awesome.
Yeah. I was thinking individual provider or respite provider, but I think those are two different things.
I think you're right. I think respite has to do with someone coming in to kind of relieve another caregiver, maybe.
Yes, that's exactly right.
Yeah. Yeah.
Yeah, it was just confusing at first, but yeah,
Too many names.
too many names, yes. What have you learned in doing this kind of work as a physical therapist?
Gosh, what have I learned? Um, I think what's interesting is the longer I do it, the more I realize I have to learn. Which is kind of funny because there's never ending information and there's never ending advances in the area of healthcare. And so one of the things I've learned is to stay curious and continuing to seek out more opportunities to learn more about my field and people's needs. And then the other thing I would say is, one of the things I've learned as I've gotten further along in my career is one of the best skills I can cultivate is my ability to listen really well and adapt as needed, because I may think I know what's best from the beginning and often I don't. And so
Hmm.
if I listen and adapt, it's always listening and adapting to make sure we that I serve my patients really, really well, and help them meet their goals and not just my own goals for them.
Yeah, because everybody's different, right? So
Certainly, certainly.
yeah.
Hmm.
So for those who want to do what you're doing, become a physical therapist, what
Yeah.
tips or advice would you have for those who want to do what you're doing? Because I have a friend, who is going to therapy school and wants to become a physical therapist. And so she wants to do that. So what tips, advice would you have for her or for other people in her position?
Oh, that's a great question. One thing I would do is if you're starting to feel that interest of going into the field, is to observe as much and as many different places as you can early on, even in middle school or high school, if you have that opportunity. There are many. I don't live in a huge town, but there are still many different places where you can go and find either outpatient physical therapy clinics, school-based physical therapists, therapists who do home health, hospital systems where they're therapists, and most really enjoy having students come and observe and sharing what they do. So get as much exposure as you can early on. And then when it comes to being in school before you get into physical therapy school, it would be to take as many math and science-based classes as you can, because that looks good on your application to applying to physical therapy school. And then networking and getting to know people and volunteering. A lot of, if you're applying to physical therapy school, while they do look at your grades, they want to make sure that you have a servant's heart, and that you are really have been exposed to a lot of different healthcare scenarios. So I would say volunteer, find places to go and serve people who are needing physical therapy or in the medical community. Any volunteer work or service-based volunteering that you can do will help you to develop your compassionate listening skills as a physical therapist, but also will help with the application process.
Hmm. That's
Mhm,
cool. It's great.
mhm.
All right.